Hello out there. I guess courtesy demands I say good evening. Well, it's a good evening considering that things could have been worse if you take a look at Europe and America. Good evening and welcome to the third consecutive week of News Extra, completely overshadowed by news of the coronavirus pandemic. And the good news is the determination of Nigeria to contain it. In short, today we have reports on the good, the bad, and also the ugly side of COVID-19. Let me not keep you waiting and just get a feel of the package yourself, as the taste of the pudding is in the eating. I am Fatima Umar Buba, and this is News Extra. You're welcome. As at today, April 2020, additional 16 cases were reported in Nigeria. We have 10 in Lagos, 2 in FCT, 2 in Oyo, 1 in Delta, and 1 in Katsina, bringing the total to 254 in Nigeria. Of the total number, 44 were discharged and also 6 deaths. And as China lifts lockdown order on Wuhan, after 3 months, Egypt extends nationwide nighttime curfew. Here is our Debola Brooklyn Sunday with global update on COVID-19.
Thanks for joining me. As at 6:30 p.m. local time, 1,563,157 cases have been recorded, with 84,807 fatality. Meanwhile, the World Health Organization's European office has said, despite seeing positive signs from some countries, it was too early to scale back measures aimed at containing the spread of the new coronavirus. In another development, the head of the European Research Council, Professor Mauro Ferrari, has resigned in protest against the bloc's handling of its coronavirus response. Spokesperson of the Commission says the body regrets the resignation of Professor Ferrari. These times of unprecedented crisis in which the role of the EU research is key. In Spain, the number of daily coronavirus deaths rose for the second time as 757 people died over the past 24 hours. The health ministry says the pace of the proportional daily increase in the death toll slowed down slightly. And British Prime Minister Boris Johnson has spent a second night in intensive care. Report says he is in a stable condition after receiving oxygen supports for COVID-19 complications. In the Middle East, Iran's new coronavirus death toll has climbed to 3,993, with 121 more deaths in the past 24 hours, with the total number of infections in the country risen to 64,586. President Hassan Rouhani has urged the International Monetary Fund to give the country the $5 billion it requested in emergency funding to help Tehran fight the coronavirus outbreak. And in Africa, the COVID-19 surveillance update as at 6:50 p.m. shows that the continent has a total number of 10,252 positive cases spread across 52 countries, with 492 deaths and 989 recoveries. Still in Africa, Egypt's Prime Minister Mustafa Madbouly says the country will extend a nationwide nighttime curfew by 15 days until April 23 to counter the coronavirus spread after Egypt confirmed new 9 deaths from the virus, raising the death toll to 94 and bringing the total number of infected cases to 1,450. A ban on travel from Wuhan has been lifted, with the first train leaving the city early on Wednesday morning. The city has been in strict quarantine since the end of January as part of a series of measures to try and curb the spread of the virus. I am at Debola Brooklyn Sunday.
Global update there. Now, Nigeria is now having fewer cases of COVID-19 from returning travelers, but beginning to experience community transmission of the disease in the country. This was one of the highlights of the daily briefing by the Presidential Task Force in Abuja. Michari Peng reports.
As expected,
the Presidential Task Force resumed its daily briefing in Abuja after a day of operations in Lagos, the epicenter of coronavirus pandemic in Nigeria.
I solicit
The chairman, Boss Mustafa, believes synergy among the federal and state governments has to step up as more cases are recorded.
not to make pronouncements or take decisions that would undermine public safety in this regard.
The task force advises public and private health institutions in the country to brace up for more cases of coronavirus.
Please look out for patients presenting with unusual respiratory tract infections, especially severe respiratory tract infections that cannot be explained, because this is an important indicator now for testing for coronavirus infection.
We have 9 laboratories for testing as at today.
We have trained a total of 270 healthcare workers in each state on case management. These trainings have built capacity among our healthcare workers, not only for this outbreak, which is absolutely critically needed, but also for the future.
There were updates on returning Nigerians.
We've now started to get greater numbers of Nigerians, especially in the United States, where almost 200 have now indicated willingness to return. We're engaging with our embassies in China and our High Commission in London and also in France.
And then a clarification.
No member of the committee receives a penny as sitting allowance. Everybody sacrifices his time, his energy, and even sometimes his resources.
Judging from cases and reports received the world over and in Nigeria, the coronavirus is no respecter of persons or status, tribe or creed. The Presidential Task Force believes that the more Nigerians abide by the restriction and precautionary measures, the better for the health and wealth of the nation. In Abuja, Mitaire Ikben, NTA News.
In the meantime, medical protective items worth over $1.5 million has been delivered to Nigeria by the China Civil Engineering Construction Corporation, CCECC, to fight the spread of coronavirus pandemic. Aviation correspondent Emmanuel Anyemiru, monitoring activities around the Nnamdi Azikiwe International Airport, Abuja, since the lockdown, reports that representatives of both Nigeria and China were on ground at the airport to receive the consignment.
This is the second foreign containment effort coming from China after that of the Jack Ma Foundation, which came in a couple of weeks ago. This time around, a construction company that is based in Nigeria, CCECC, donated some of these items which came in from China via a local airline, Airpeace, that landed at the Nnamdi Azikiwe International Airport, Abuja.
Although personal protective equipment were not opened, the Chinese ambassador to Nigeria, Dr. Yunping Jin, who on behalf of the Chinese government says the items include 60 tons of test kits, ventilators, disinfection machines, disposable medical masks, medicine, rubber gloves, protective gowns, and goggles.
The value of the equipment, medical supplies, is around $1.5 million, and including the other costs, like the chartered air flight, it's all around $2 million.
To dispel the rumor about the capacity of the 15-member technical team from China Railway Construction Company, which CECC is a subsidiary, Minister of Health Dr. Osage Ehanire says 12 of them are experienced medical professionals who are going to be subjected to the quarantine procedures.
They have undergone tests before they left their country. Nevertheless, they will be in quarantine for 14 days. Nigeria NCDC has gone to see where they are supposed to be in quarantine and will continue to pay. They are free to pay visits there throughout the 14 days. But the equipment that has come today, we are very happy to see. So we believe it will help us a lot in addressing the gaps that we will have had in commodities and also very important equipment. When you ask how many ventilators you have, we have 50 ventilators more after this visit.
CCECC is also participating in the construction of 2 COVID-19 response facilities in the FCT at no cost to government as part of its corporate social responsibilities. Meanwhile, those items have been disinfected in line with airport procedure. Emmanuel Ayemiro, NTA News.
So much, Emmanuel, for that. And Port Harcourt Magistrate Court has remanded 2 pilots with a private helicopter company in Correctional Center. The pilots allegedly disobeyed the executive order issued by the Rivers State Governor aimed at checking the spread of coronavirus in the state. And we have Chiazala Mekizie reports.
The court, presided over by Chief Magistrate Inhwa Madwenyi, remanded the pilots at the Port Harcourt Correctional Center till May 19, 2020, when their trial commences. The Chief Magistrate ruled that COVID-19 tests be carried out to ascertain their status. The Prosecution Counsel and officer in charge of legal, Rivers State Police Command, is Gladys Amadi.
They flew into the state against the order and directive of the governor with respect to restriction of flight movement. They've been flying into the state, and today we got information and they were arrested, and they confessed to that.
The pilots arrested on Tuesday, 7th April by Rivers State Police Command were arraigned on the 8th of April. Chiazalam Ekie, NTA News.
And the Minister of Aviation, Hadi Sirika, says aviation matters are on the exclusive list of the federal government. The minister said this while reacting to the arrest of the 2 pilots at the Port Harcourt airport.
Regarding the question that has been asked, the arrest of pilots in Port Harcourt, whether we give them approval to fly. Civil aviation is on exclusive list, item number 3 there. So no other person but the federal government has authority to legislate upon. So also the Nigeria Air Force, part of armed forces, is also on exclusive list. There's no other person but the federal government that has the legal right to legislate upon. So the Air Force officer who jumped the commander-in-chief and ignored, who also jumped the chief of defense staff and ignored, who jumped the chief of air staff and ignored, to call a governor to come into the property of the federal government belonging to Nigeria Air Force to make an arrest, has exhibited dangerous ignorance and incompetence grossly. So the police that followed the governor also to go in there has also exhibited dangerous ignorance from our perspective in civil aviation. Whether we gave approval for the flight, yes, we did. And we did in national interest. All of those flights are for the purposes of improving the national revenue, to which Rivers State is the greatest beneficiary. So those flights by Caverton, by Aero Contractors, by ARIC, by Bristol, and couple more were for national interest and improved national revenue. At a time when oil has gone below $30 and the cost of production is $30, in the wisdom of President Muhammadu Buhari, he thought that this be allowed even in this national pandemic so that the nation will not be crippled and national revenue will not be lost. It's against this background that we had the authority, and being it exclusively on the exclusive list, and we had the powers in civil aviation, guided by Civil Aviation Act 2006, approved such flights. So those flights were approved lawfully, legally, and correct.
Minister of Aviation there, Hadi Sirika. To a bit of good news now, how 7 persons have been certified coronavirus-free after isolation and treatment at the University of Abuja Teaching Hospital, Gwagwalada. This is the first round of COVID-19 patients discharged in the Federal Capital Territory. And Hakimat Aliu is on standby with this update.
For an update on COVID-19 and the situation in the Federal Capital Territory with a success recorded in the discharge of 7 patients, I will be speaking with the Acting Secretary, FCT Health and Human Service Secretariat to give us more insight.
We have discharged 7 COVID-19 patients that were admitted at University of Abuja Hospital, Guakwalada, yesterday. Amongst them, 3 female, 4 males. And the rest are doing very, very well. We hope to discharge more in the coming few days. We have 50 patients, 50 confirmed cases of COVID-19 FCT so far. We lost 2.
Now we're here at the Asokoro District Hospital, which is converted, and I can see work is ongoing for an isolation center. People want to know, we have patients here before, where are they? Those receiving treatments and all that.
In FCT, we decided to urgently create another isolation center. As you know, Guakwalada is getting filled up. This hospital has been fully functional, so we decided to transfer the normal patients to other sister hospitals, Maitama, Wuse, Kubwa, and other hospitals, to convert this fully as an isolation center. We needed to fix 1 or 2 things. Most of the work has been completed, about 95%. Some supplies are already here, the PPEs, consumable drugs, and by God's grace start admitting on Friday, being 10th of April 2020.
That's the update from the FCT.
Well, thank you so much, Hakimat, for the update. Now we'll take you to Yobe. Yobe State Government, through the State COVID-19 Prevention and Control Committee, has approved the extension of REC from Home Directive for civil servants till 30th April as part of new preparedness, response and control measures initiated against coronavirus. Yunus Suleiman reports that the committee has also received donations of medical equipment from the Northeast Development Commission and Nigeria's Center for Disease Control for distribution to isolation centers.
Through the COVID-19. In view of the prevalence of COVID-19 in certain parts of the country, the State Commissioner for Home Affairs, Information and Culture, Abdullahi noted that the measures taken by the committee cut across sectors and domains and are designed to ensure a holistic and comprehensive approach to protecting the people and maintaining the zero case status of the state. The committee also resolves as follows: that in view of the ongoing prevalence of COVID-19 in certain parts of the country, movement into and out of the state, especially across our borders with Jigawa and Bauchi states, will continue to remain restricted. The security agencies, especially the police, civil defense and vigilantes, will continue to enforce the restriction. That the stay at home and work from home directive for civil servants from grade level 12 and below has been extended until April 30th. Meanwhile, the State COVID-19 Prevention and Control Committee has received donations of medical equipment from the Northeast Development Commission and the Nigeria Center for Disease Control for the state to strengthen its preparedness, prevention and emergency response efforts against the outbreak of COVID-19 in the state. Items donated are personal protective equipment, ventilators, surgical masks, infrared thermometers, hand gloves, as well as hand sanitizers, among others.
So these items came at the right time, though we obviously have not reported any COVID-19, and inshallah we're not praying for. But all the same, it is good to keep our self-hygiene to ensure that our people are safe from this COVID-19.
Health experts are assertive that the donated equipment are critical to halting the spread of coronavirus. In Damatru, Yunus Suleiman, NTA News.
And one of the preventive measures adopted by the Ondo state government, among others, since the outbreak of coronavirus pandemic, is to disinfect its public places, especially markets, to manage the spread of COVID-19. The exercise, which commenced at the state capital, has been extended to other parts of the state as government steps up its enforcement mechanism for effective compliance with orders on social distancing. And we have Olajide Bello there.
Market transactions were active without any hindrance at Okitipupa and Igbokoda main markets as traders and sellers defied government directives on market closure and social distancing.
Don't leave it there, pack it.
Definitely, you would notice that there is a lot of scamping here. The locking of shops, which was ordered by the Ondo State government, was not fully implemented here. And before this place would be fumigated, people have to be evacuated. And that is what the committee is doing at the moment.
Officials of the task force on COVID-19 in the state, along other security operatives, had to evacuate the people from the market before fumigation could commence. They expressed displeasure over the nonchalant attitude of the people to ensuring that government directives are adhered to.
And I'm using this opportunity to assure every citizen of Ondo State that we are passionately committed to this assignment and we will certainly put in our very best to ensure that the assignment is carried out to the letter.
Aside the fumigation exercise, not many residents have adequate knowledge about the proper use of face mask, hand washing, as well as identifying highly hazardous sanitizing products. Medical experts maintain that such information must be included in the advocacy against the spread of the dreaded virus.
We make sure that we wash our hands, just like I demonstrated. You wash your hand properly, at least for 20 to 30 seconds. If you are using ordinary water, you use soap to wash it very well. If not, you use chlorinated water, 0.05%. Then, for people that doesn't have access to that, you can use your sanitizer.
Although directive on total closure of markets in Ondo State is still in force, many traders were seen defying the order by opening their shops for transactions, while some were hanging around their shops to sell discreetly to customers. The state government says this is unacceptable as all the directives to check the spread of the virus are still in place.
Closing down the markets, the order is still on, and people should still adhere strictly to directives given by government. It's in the interest of everybody, not just that of government alone.
For now, both human and vehicular activities have reduced on major streets as government intensifies campaigns towards curtailing person-to-person transmission. Olajide Bello, NTA News.
And back in Abuja, the FCT Minister, Mohammed Musa Bello, has disclosed that over 150 hospital beds have been installed, together with protective kits at the Idu Isolation Center as part of efforts to contain the spread of COVID-19. The minister, who made this disclosure at the inspection of facilities at the center, described it as a reflection of what partnership can achieve. Ifeanyi Zumba reports.
Paris Bank, Faith Foundation, CCECC Construction Company are among organizations that contributed to the setting up of the Idu Isolation Center, provided by the Federal Capital Territory Administration as treatment center for COVID-19 cases. FCT Minister Malam Mohammed Musa Bello says the private sector initiative was built under the leadership of a former Minister of FCT, Modibo Ali Umar, whose collective effort complemented that of the FCTA.
Our desire is that, in spite of all the arrangements made, no patient should even arise. We have to really appreciate and follow all the instructions given by our medical personnel regarding social distancing, regarding personal hygiene, regarding constant washing and washing of hands using soap.
The minister inspected the level of work done at Access Road to Gozadam site at Asokoro District Hospital. The medical director, Afioma Uche, said they have worked hard to ensure that facilities will be available for admission of COVID-19 patients. She also emphasized that non-coronavirus patients in the hospital are safe.
By Friday, by the grace of God, and all necessary strategies, equipment, and coordination has been put in place for that purpose.
The FCT administration commended the management team of Asokoro District Hospital for doing a tremendous work and called on all to put in their best, adding that together the nation would defeat the dreaded COVID-19 pandemic. In Abuja, Ifeanyi Zumba, NTA News.
And in another development, 500 beds and other medical equipment have arrived at Sani Abacha Stadium Isolation Center in preparation against COVID-19 in Kano. Fatima RIA reports that other preparations are also at an advanced stage for the center to be well equipped and ready for use if need be.
509 makeshift isolation center was established out of desire by the state government in collaboration with Dangote Foundation to fight the spread of the deadly pandemic which is ravaging nations.
This isolation center is meant to treat only mild cases of coronavirus.
If there's any confirmed case, that's the one that will be moved forward to this particular isolation center. So it's not going to be open for everybody.
The center will house both female and male sections with 254 beds each in 2 different tents with mobile lavatories.
If there's any critical case, it can be transferred to the Kwanara Dawaiki Isolation Center, where we have ICU beds, ventilators, and other oxygen and other facilities.
Kano State has not recorded any confirmed case of novel coronavirus, as all suspected cases tested negative.
In Kano, Fatima RIA, NTA News.
And from Kano, we'll take you to Jigawa State, where surveillance activities and possible contact tracing intensified around Kazaure and Daura, being border towns between Jigawa and Katsina State, in an effort to control the spill of COVID-19 into the state, following the death of a medical doctor in Daura, Katsina State, on Tuesday. Governor Mohammed Badr Abubakar disclosed this while inspecting isolation centers across Dutse metropolis set up in any case of any eventuality. Mohammed Musa Askar completes the report.
A governor who reaffirmed the commitments of his administration to leave no stone unturned in the fight against coronavirus also stated that Jigawa State may not be safe if things are let to go unchecked, given the level of interaction between Katsina and Jigawa States through Daura and Kazaure local government areas.
We are very close to Daura. Our people in Kazaure, Yamkwashi, and Roni are very close there. And with the case in Daura, we have sent our surveillance team to work with the Katsina State government to find out if there are any interaction between Jigawa indigenes and that of Katsina indigenes.
In an effort to ensure that the state is fully prepared for any emergency situation that might crop up as a result of the COVID-19 pandemic, the state government, through the task force on coronavirus, set up an isolation centers at the Rashid Shekoni Specialist Hospital and the NYNC orientation camp with close to 350 beds capacity.
What is important is to concentrate in contact tracing and the information that we are getting from our Jakadul life here on the movements of people and people that develop symptoms.
Though he prayed that the centers are not used for the purpose they were set up, Governor Mohammed Badr Abubakar stated that the centers are going to be equipped with ventilators among other facilities critical to the treatment of the COVID-19 victims. Now, serious efforts have been made to control trans-state border movements, particularly between Kazaure and Daura local government areas of Jigawa and Katsina states, which recorded its first death from the coronavirus on Tuesday. Task Force on Coronavirus in Jigawa State has so far isolated over 200 suspected cases of the disease. 12 samples were taken out of the number to Lagos for testing. 10 results have returned, having been tested negative, while 2 more results are still awaited. From Dutse, Muhammad Musa Askira, NTA News.
A beautiful development there, Mohammed Musa Askira. Now, let's join the Executive Governor of Jigawa State, Mohammed Abubakar Badaru, live via Skype. Now, you're welcome to a News Extra, Mr. Governor, if you can hear me. Mr. Governor, can you hear me? Okay, it seems that we're having, issues with the connection now. Now we're going to get back to the governor, probably via Skype or telephone call. Well, it's up ahead now. We have Fire Guards Treasury House in Abuja and happenings around COVID-19 lockdown in states. When we return, please stay tuned.
For now, the best and most efficient way to avoid getting infected is through regular hygienic and sanitary practices, as well as social distancing. As individuals, we remain the greatest weapon to fight this pandemic. By washing our hands regularly with clean water and soap, disinfecting frequently used surfaces and areas, coughing into a tissue or elbow, and strictly adhering to infection prevention control measures in health facilities, we can contain this virus.
Power outages have become part of our lives, and life can be a nightmare without power. That's why, now more than ever, you need to take control of your life with Omaha Portables.
The power output of every Umar generator is exactly as stated in its power rating.
As long as there's Omaha, your home will have the reliable power you thoroughly deserve.
Omaha generator gives us peace of mind because it never fails us.
Omaha Portable Generators, inspired by you. Amazing Bluetooth, gripping 4K, high-def satellite receiver, vibrant colors, make you feel truly immersed in the action. Omaha Television, inspired by you.
You've seen me promote Lifebuoy soap, but today I urge you to use whichever soap that is nearest to you, because washing hands with soap helps to fight the coronavirus. This is a public service announcement from Lifebuoy.
You can choose to do this with your stew, but not your data. Get more out of life with the new Airtel data plans. Dial *141# today. Data is life.
Airtel, the smartphone network. Since 1971, Nigeria's foremost human capital development institution, the Industrial Training Fund, ITF, has been at the forefront of equipping Nigerians with skills for national growth. Today's ITF has repositioned and refocused its programs, forging new partnerships locally and internationally to effectively deliver on its mandate. With 37 area offices and 5 industrial skills training centers across the country, ITF is pushing to reduce unemployment by providing relevant technical and vocational skills for employability and entrepreneurship in diverse trades and crafts. Whether you're a public or private organization seeking to improve the skills of your personnel or an individual looking to acquire skills that will increase your chances of employment or even to help start your own business, today's ITF has a program for you. Speak to us today. Contact our area offices nationwide or visit our website www.itf.gov.ng. ITF, developing the nation's human resource.
Happiness can be found in the little things, even in just one smile. Stay positive, stay home, and stay nourished.
Mortina, share happiness.
There is a lot of fake news and report circulating, especially on social media, on the coronavirus. Do not believe or partake in the spread of these fake reports. If it is not on the official website or news from the Nigerian Center for Disease Control, NCDC, disregard such report. Only together can we beat this virus. Only together can we overcome this pandemic. Follow the instructions and guidelines provided to combat this virus. Most importantly, stay at home. Self-isolate, regardless of your status. The virus doesn't move unless we move. Let us work together to better Nigeria. Together, we can do this. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
You're welcome back to News Extra. And earlier we had issues with Skype with the governor of Jigawa State, but now let's rejoin him as we have the executive governor, Muhammad Abubakar Badaru, via telephone now. It's good to have you on News Extra, Mr. Governor. Mr. Governor, can you hear me? Well, it's good to have you. Well, I would say we're really happy that Jigawa State is one of the states that are really, really lucky, you know, and it's coronavirus free. So, but what is the state doing to ensure that it stays so? Even though we just earlier, you know, watched a report that you went visiting to isolation centers in preparations to curb the virus.
Well, as you are aware, we have closed all schools in the state from basic education to tertiary, and we have banned gathering for more than 20 people. We have blocked all our borders with the neighboring states, and all our workers are working from home. And major markets in the state where you have massive congregation of people has been banned, and we are watching seriously and taking census of whoever comes into the state if he manages to come. As we are aware also, in Jigawa State we have what we call the kind of mafia in almost every village and every town.
Okay.
And these people always report to us if there are influx of people from other areas, more especially areas where there is already the pandemic. So we will get daily telephone messages, and we send our surveillance team each and every area where we have these incidences to check on the people. Where it's necessary to have samples, we take samples. As of today, we have done over 400 visits, and from there we have generated about 12 samples, of which 10 returned negative, and 2 are still to come, and we are sending another 4 samples by tomorrow also. So we are watching very carefully, and the people of Jigawa State are being very supportive. Any new person that comes into town, we know now, and we will try to check and profile him. If it's necessary to take samples, we take samples. If it is necessary to put him on self-isolation,
okay.
Put him in self-isolation.
Okay, Mr. Governor, you really, indeed, you have a lot going on in your state. But now, Kazaure in Jigawa is, you know, close to Daura, where the COVID-19 patient just died. What does this worry you? And yes, if it does, what are you doing about it?
Well, we already sent our surveillance team to Daura to work with the Fatima state government. To see, because this doctor has been seeing some of our patients from Jigawa that neighbor Daura, and we are trying to profile those people, try to find them out if they have met him within the period, and see how we can put them in self-isolation and proceed from there. We are working seriously with the state government, and it's
very serious hunt. And our surveillance team are very busy with them, and we are sure we'll trace all the people that have contact with this doctor that died and put them in self-isolation where necessary.
Okay, you know, we cannot talk about states without talking about the less privileged. Okay.
The border, the blockage of the border. All routes linking Daura from Jigawa State is being blocked. And we are watching on this very, very carefully.
Okay, thank you so much, Mr. Governor. Now, like I said, we cannot talk about states without talking about the less privileged in the state. So what are you doing to cater, you know, for them in this period?
First, I have to thank Mr. President because in Jigawa, we have about 76
76,000 households received the 20,000 naira support from the federal government, and we are looking also to see what kind of palliatives we give to our people. The team, the task force, is working day and night and appropriate way to give palliatives to the people of Jamaica.
Okay, thank you so much, Mr. Governor. There, yes, you have a lot going on in your state. We'll just say keep up the good work, and you're welcome again to News Extra, I must say. Now, moving on, fire at the Treasury House. I know so many thoughts running through your mind, the salary and many more. Yes, I share in such fears initially when the news of a fire incident at the office of the Accountant General of the Federation filtered in around 10 a.m. today. But later, Mayor Ogidi visited the scene of the incident and says there is no cause for alarm.
Abuja, a city experiencing 14 days of lockdown to fight an unseen enemy, COVID-19. But fire defied this lockdown order, as it were, and visited the nation's Treasury House. Smoke sighted from afar, announcing the presence of the fire. 25 firefighting trucks arrived swiftly, and the smoke ceased.
The fire has been extinguished.
It was the 4th floor of the building, and the Minister of State, Budget and National Planning gives an assessment.
An officer came to the office. He said he put on the air conditioner and there was a spark, and he noticed smoke, so he immediately put it off. But it was still smoldering, so he had to rush out to get some help. And I'm glad to report to you that our data center, where all our records are kept, they are fully intact. There is no destruction, so we haven't lost any record.
Going to be an investigation to be instituted, and we should allow investigation to say it as it is. It is indeed a sad incident at the Treasury House. But on the other side, it is also a reminder, especially those whose houses and shops and offices are locked down during this period, to ensure that their electronics are also put off. Mayor Ogidi, NTA News.
Yeah, very unfortunate one, I must say. Now, as the lockdown ordered by the federal government enters D9, Assistant Inspector General of Police, AIG Zone 2, Ahmed Ilyasu, warns any criminal that may want to take advantage of the stay-at-home order to commit crime to stay off the zone. As such, people will be dealt with decisively according to the law of the land. The AIG gave the warning while monitoring compliance with the lockdown order in the states under his command. And then Nojo Adiku has the report.
The AIG Zone 2 in charge of Lagos and Ogun states, Ahmed Ilyasu, visited some areas like Oworoshoki, Ketu, Ojodubega and Shagamu to assess the level of compliance with the 14-day lockdown directive against the spread of COVID-19. The AIG and other stakeholders commended the cooperation of the citizens with the law enforcement officers in the areas visited.
Following the widespread pandemic of COVID-19, in view of our constitutional mandate of administrative, operational and other supervisory role to go around and check the level of compliance both in Ogun and Lagos states. And we're also reviewing the pattern of crime, the dynamics of crime following the restriction and lockdown, so that criminals will not take advantage of the gap that is left within that period. Our men have exhibited quality, a highest sense of professionalism, of capability and capacity to carry out their job with great humility in line with best practices of modern policy in the 21st century.
So far so good. I think I'm satisfied.
The AIG said monitoring is a continuous process which is key to weeding off criminal elements who might want to hide under the lockdown to perpetrate their dastardly act. The AIG was accompanied by both Lagos State Commissioner of Police Hakeem Odumosu and his Ogun State counterpart CP Kenneth Abramson. In Lagos, Enojo Adiku, NTA News.
From Lagos, we'll take you to Kaduna, where Kaduna residents enjoyed a 2-day window, Tuesday and Wednesday, out of the 24-hour curfew imposed by the state government to contain the spread of COVID-19 pandemic. The state was again back to life as the people raced to meet the demands of their families within the 48-hour, which elapses midnight today. And Abdullahi Mohammed likens the situation to a life on Fast Forward.
It's like the start of a 100 meters race. The rush at top gear, with many speeding against time to get some cash and restock their homes and stores. But to some, the 2-day window for Kaduna citizens to brace for the curfew towards curtailing the spread of the COVID-19 is to make enough money that will sustain the family until the next weekly window opens. Yusuf is one of them. He sells eyeglasses, and each time the traffic comes to a halt, he presents his wares, but sales is scanty. And he has limited time to meet his target of 5,000 naira, which he believes will sustain his family for the next coming week.
For now, I have not sold anything, and if I don't, then I am in trouble.
When people like Yusuf and his colleagues continue to struggle in terms of convincing people to buy their products, it's a brisk business for others who produce sanitizers, as this product has become one of the fastest selling products across the world. In Kaduna, Abdullah Muhammad, NTA News.
In the meantime, the Federal Capital Territory ranks second highest with its number visited of confirmed cases of COVID-19 in the country, which brings about demand for more health facilities to contain the spread. Health correspondent Hakimat Ali visited the isolation center created at the National Hospital, Abuja.
As correspondent in the Federal Capital Territory, I have kept tab on developments to keep residents abreast of necessary information, analysis, and efforts of the administration in curbing the spread of the dreaded coronavirus disease. This time, I visited National Hospital, Abuja, one of the places designated to have an isolation center, but not without fully kitting up with my protective gears provided by the management of the Nigerian Television Authority. Then I proceeded. However, I found out the isolation center is presently occupied with a number of suspected cases of COVID-19 patients. So I didn't go beyond what I considered the red line for my safety.
Our isolation center here for suspected COVID-19 patients. The center, the federal government team, they came to come and inspect the center, and they are satisfied with what we have here.
In spite of that, the hospital is still open and running to attend to other health needs.
We have the accident emergency center, and also we have the trauma, with the gynae section. They are all working, because even at this lockdown, you might have people that want to give birth to a baby who might likely be in labor, and so it's open. We might like people that have emergencies, and so we open our emergencies.
Still at the hospital, we ran into some staff of the Nigerian Center for Disease Control. My guess is they are probably here to get samples of the suspected cases of COVID-19, but that I couldn't establish, as they were just on official assignment and not permitted to speak. In Abuja, Hakimat Ali, NTA News.
Well, thank you so much, Hakimat Ali, for that. I really love the way you're dressing. Yes, safety is key, so keep safe. High-tech laboratories with biosafety systems and other equipment for the testing of coronavirus are to be established in Akwa Ibom State. Already, the state government has acquired 2 PCR machines and is expecting more from private donors for the smooth take-off of the laboratories. And Ifoma Ekoje reports.
The COVID-19 test laboratories, which are to be sited at the upcoming Infectious Disease Hospital, Itumbang, and Ibo Multi-Specialty Hospital, Uyo, Akwa Ibom State, will complement the existing 7 across the country. While the machines are expected to be fixed within the week, the laboratories will start operations soon after NCDC's accreditation.
The machine is going to arrive here within the next 2 days. Essentially about 3 of those machines are going to be with us within this week, and I'm sure that barring any mishap, we should be able to start being able to test very soon.
Meanwhile, the contact tracing for a suspected COVID-19 patient who reported to a private hospital in the Akwa Ibom State capital has commenced. An unconfirmed report has it that the patient was whisked away by relatives when the health personnel attempted to notify the COVID-19 surveillance team.
We are going to reach out to that person if that is true. We've made contact with the doctor who had the clinic, who had this clinic, but the story that there was a case of corona yesterday has not been confirmed.
While the government and relevant institutions pool efforts to contain the pandemic, everyone is expected to take responsibility for their health. If we must sound it again, wash your hands regularly, practice healthy respiratory lifestyle, and call the doctor when in doubt. In Uyo, Ifoma Ihoji, NTA News.
Now, as the federal government is pooling resources together to fight COVID-19 in Nigeria, academic institutions are also making gateway towards filling in the gap in the health sector, especially in the areas of testing and treatment equipment. From Bauchi, we have Mahmoud Ibn Mohammed reports that the Abubakar Tafawa Balewa University has invented some coronavirus treatment and testing equipment.
Necessity, they say, is the mother of all invention, especially in time like now, that the world is fighting a common enemy, that is the COVID-19.
With Nigeria having its fair share of the pandemic, government at all levels with the support of corporate bodies, groups and individuals are working round the clock towards finding solution to the COVID-19 scourge. For the academic and research institutions, it is an opportunity to look inwards towards coming up with solutions to some of these problems. And that the Abubakar Tafawa Balewa University of Technology, Bauchi, has done with the invention of a disinfectant, ventilator, aerosol box, and the ATBU COVID-19 CXR classifier, a software for coronavirus test.
Academics all over the world were contributing to solve problems, particularly problems of treatment, repurposing drugs to treat COVID-19, vaccine, research of vaccine, as well as research on medical equipment, because whatever has been available has become scarce. So most hospitals are having high volume of patients with very few ventilators and other vital medical equipment to cope with the pandemic.
With the capacity to do more, the Abubakar Tafawa Balewa University is determined to provide solutions to some of the nation's health sector challenges, especially in the areas of equipment and software development.
We learned about these ventilators, and we found that why can't us think of a ventilator? We now call and we assemble the engineers. We want to have a ventilator in this week or 2. Can we have it? They said, let them try. So we, the university, said, okay, give us your cost. What is the financial implication? And they gave, and I think we have done our own part. And the engineers have done their own part. I think what we are trying to say is that if we can have encouragement from government, we will do more than what we are doing now.
These school premises, they were all the office equipment, so we had to get a lot of them and then look at their mechanisms, how they work, and then see how we can be able to repurpose and then come up with our own design. So we had a host of those equipments, and then some part of the systems we had to design them from the scratch. So we did it and then put everything together, and then we had our systems working.
In Bauchi, Mahmoud Ibn Muhammad, NTA News.
A very impressive development there. Kudos to them. Now, in view of the growing demand for personal protective equipment against the spread of COVID-19, a private tailoring, garment and kitting factory in Kaduna, LG Hub, has commenced massive production of face masks for wider consumption. Suleiman Abdullahi Rigachukun reports.
Inaugurated in 2017, El Jahab Tailoring, Garment and Knitting Factory, Kaduna, specializes in production of military, paramilitary, school uniforms, and suits. With the outbreak of coronavirus pandemic, the factory has begun the production of durable face masks for domestic use and export as part of its contribution to ongoing efforts to prevent the spread of the dreaded virus. Materials used in production of the face masks are well thought. You can breathe and speak while wearing it.
This reusable mask is for the community, it's for the general population. So what it does is it reduces the amount of spread of the virus. Like we all know that viruses are smaller than bacteria.
Our quality is the standard quality. You cannot see it anywhere in the Africa.
The factory produces over 15,000 pieces of the face masks daily.
So one of the key things is to have the government basically in support of us so that we can give out this mask for mass people so that they can also use it more and also protect lives from this deadly virus that we are facing.
In compliance with measures to prevent the spread of COVID-19, the factory selected 100 out of its 300 employees for mass production of the face masks with strict adherence to social distancing. In Kaduna, I am Suleiman Abdullahi Rigachikung, NTA News.
And the Catholic Bishops' Conference of Nigeria has donated 435 hospitals and clinics belonging to the Catholic Church nationwide to the Presidential Task Force on COVID-19 to help combat the pandemic in the country. This was contained in a statement by the Director of Information, Office of the Secretary to the Government of the Federation, Willie Bassi, making the donation in Abuja on behalf of the Bishops' Conference. The Catholic Archbishop of Abuja, Archbishop Diocese, Bishop Ignatius Kagama, commended the Presidential Task Force for various steps taken so far to curtail the further spread of the disease in the country and pledged the full cooperation of the Catholic Church with all decisions of government on COVID-19. Receiving the donation, the chairman of the Presidential Task Force and secretary to the government of the Federation, Bas Mustafa, expressed their appreciation to the Bishops' Conference for making their medical facilities and clinics available to the task force. He said the facilities would assist medical practitioners in their efforts to bring the pandemic to a standstill in the country. The SGF urged other faith-based groups to lend a strong voice to the decisions of government, particularly on restriction of movement so as to halt the spread of the pandemic. And cushioning the effect of a lockdown, upswing with more benefactors reacting out to the needy and most vulnerable at this trying moment. When we return from this break, we'll talk about that. Please stay.
Molfix pants with anatomic fit technology. New Molfix pants, inspired by babies.
When I was a little girl, I loved spending time with Mum and Grandma cleaning the house. I was so excited to sing in the choir. And your shirts are always so white. I knew what Mum's secret was. Today, I'm a modern woman that still trusts the secrets passed down to me. It's Jik, of course. The original trusted bleach, which can be used all around your house for amazing results.
Shh, it's our little secret. It's no secret. It's Jik's best ever extra whitening power. Just Jik it.
What we are really cultivating here is a better future for all Nigerian women, and it's not always easy. Panadol Extra relieves headache, backache, joint pain, toothache, and menstrual pain. The pain is worth it.
Breakfast your day. Every day.
Nestle, good food, good life.
The coronavirus, also known as COVID-19, is spreading at an alarming rate all over the globe, including Nigeria. With the number of infected persons in Nigeria increasing daily, prevention is better than cure. Coronavirus has no cure. The virus spreads from one person, who affects two persons, and by the time the affected person is isolated, the two persons have affected four, and it keeps spreading. You must take preventive measures to save yourself and that of the people around you. Always wash your hands with soap and water. Put distance between yourself and others. Whenever you cough or sneeze, cover your mouth. Clean and disinfect surfaces. Stay at home if you're sick and contact the proper authorities. Together, we can cut down the spread of the coronavirus. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest TV network.
Welcome there. Have you washed your hands?
Inside my house again. This thing not the key black man.
I don't know if it's misinformation or poor hygiene that will kill you first. Coronavirus is real, and good hygiene practice will save your life. Anyway, no hand washing, no eating.
I will not take care of it. How's one of the parents?
Coronavirus is real and it's on the rise. But you can help yourself and help others to be safe. Remember, we can stop the spread. It's in your hands.
This message is from the Akinfade Foundation in partnership with the National Orientation Agency with support from MacArthur Foundation.
Thanks for staying. The coronavirus pandemic has not only forced countries to reshuffle their healthcare priorities, it has also compelled the economic team of nations to go back to the drawing board. Nigeria's Minister of Finance, Zainab Ahmed, and other key officials of the presidential economic team met the leadership of the National Assembly on plans for adjusting the 2020 financial legislations and COVID-19 interventions. National Assembly correspondent Ignatius Nkwo reports.
This is the third visit by the Minister of Finance, Zainab Ahmed, to the National Assembly within 4 weeks of the outbreak of the coronavirus in Nigeria. While medics are busy battling the coronavirus at healthcare facilities, the National Assembly and various government ministries are putting heads together to ensure adequate provision of logistics and measures that will cushion the effect of the virus on Nigeria's economy. President of the Senate, Ahmed Lawan, pointed out the need for federal government ministries to streamline their COVID-19 interventions to avoid duplication.
But we also must ensure there is equity, that there is fairness in the distribution or in the interventions. Every part of this country should have something to ameliorate the situation. And that's the issue of electricity. I'm looking forward to a package, a robust package, that will include succor to the Nigerian people on the issue of electricity for 2 months.
Minister of Finance Zainab Ahmed, accompanied by the Governor of Central Bank of Nigeria, Minister of State for Petroleum Resources, and the Director General of Budget Office, explained that while the process of adjusting the medium-term expenditure framework and the 2020 budget is in motion, the economic team at the moment is preoccupied with designing the programs that will come under the 500 billion naira COVID-19 Crisis Intervention Fund.
As we design the various programs which will include healthcare, upgrade of healthcare facilities, support to state, public works, and other interventions that we're taking your input from at this time.
This is coming less than 24 hours after similar meeting involving the legislators and the Minister of Humanitarian Affairs, Disaster Management and Social Development. From the National Assembly, Ignatius Nkwo, NTA News.
Thousands of households in Oyo have benefited from the monthly conditional cash transfer of the federal government in Oyo State. And correspondent Dayo Ogunshola reports that the beneficiaries were charged to utilize the money for pressing needs that can cushion the effect of the ongoing lockdown in the country.
For the benefiting households in Oyo State put at 13,806, this kind of intervention cannot come at a better time than now, as it's a test of the federal government's goodwill. Gathered in their tents, not unmindful of the social distance requirement to contain further spread of coronavirus pandemic, the beneficiaries, including aged men, women, and physically challenged, described the intervention as a novelty brought to relieve the poor.
We use the money for small trade, and a lot of profit is being realized for our daily needs.
Need to thank the government for coming to our aid. This is because we did not work for them. Government is only being considerate.
Just State Commissioner for Women Affairs, joined by the head of the State Cash Transfer Unit to monitor the exercise, urged the officials in charge to be accountable.
The money being given to beneficiary or the people collecting it actually gets to them, and that we have seen. But we appeal to them that they should make judicious use of it.
By the end of the whole exercise, they will not get back to the former position where they were before the exercise started.
Additional cash transfer to the vulnerable is one of the social intervention programs championed by the federal government to alleviate the suffering of the poor. In Ibadan, Dayo Ogunshola, NTA News.
Good news there, Dayo. Now, with the coronavirus pandemic adversely affecting businesses and livelihood, the federal government has given directive on the provision of food items to the vulnerable. This, the Western Marine Command of the Customs Service is keying into by providing bags of rice and other food items available from its storage facilities. The controller of the command, Olubenga Peters, said this at a press briefing to showcase seizure of 340 bags of foreign rice and 4,500 liters of fuel. And Michael Olaile reports.
Regardless of the prevailing pandemic, the Nigerian Customs Service is not compromising its constitutional responsibility as measures are being intensified to strengthen its anti-smuggling architecture and antics, especially as criminals might want to take advantage of the lockdown in Lagos to perpetrate their illegal acts. This vigilance is yielding results, which has led to the seizure of 342 bags of rice with duty paid value of 7.5 million naira. The most disturbing scenario was the use of 30 large sacks to smuggle petrol, with each containing 150 liters across border. Other items seized include 5 bales of fabric material and 2 bales of second-hand clothing.
The house we are making use of is filled up. That's why some of the items, some of the foreign rice now are now stacked outside. So within the next 24 hours, I'm sure we have been asked to send them to IDPs and the rest that continue to arrest them and seize their goods. But the best bet for them is to change their lifestyle, to change their means of livelihood from illegal business to legal business.
The entire seizure put at about 20 million naira were intersected at Yekeme and Badagry axis of the Western Waterways. In Lagos, Michael Olale, NTA News.
And still in Lagos, the Lagos state government has withdrawn charges against a former governorship candidate of the Action Democratic Party ADP in Lagos State, Babatunde Gbadamasi, his wife Folashade, and a musician Aziz Fashola, popularly known as Naira Marley. Agbolore Ogbara reports that the defendants were allegedly to have violated Lagos state law on the social distancing directive aimed at checking the spread of coronavirus.
Naira Marley, Babatunde Gbadamasi and his wife, Folashade, were charged before the Lagos State Magistrate Court in Ogba for attending a crowded birthday party, which the court said is against the Lagos State law on social distancing and the federal government directive on the lockdown. The defendants are facing a 4-count charge, but having demonstrated remorse about their action, the Lagos State government has withdrawn the charges based on 3 conditions.
Number 1 is for the defendants to write a written apology, then to undertake that they would not do that again. In other words, that they would not indulge in any such convergence again. Then thought that they should isolate themselves for 14 days, having mingled with people who are believed to be at risk.
We didn't see any problem in these conditions because our clients are law-abiding, so the charges were not read, their pleas were not taken, and the defendant, through their counsel, accepted all the conditions, and the DPP, Mr. Oshuala, applied to withdraw the charge.
Justice Afe Afunke adjourned the case till Thursday for prosecutor to brief the court on whether all the conditions have been met, failure of which they will be arraigned in Lagos. Abolore Ogbara, NTA News.
Oh, thank you so much, Abolore. Now it's time for us to take another break, and News Extra continues shortly. Please stay with us.
For now, the best and most efficient way to avoid getting infected is through regular hygienic and sanitary practices, as well as social distancing. As individuals, we remain the greatest weapon to fight this pandemic. By washing our hands regularly with clean water and soap, disinfecting frequently used surfaces and areas, coughing into a tissue or elbow, and strictly adhering to infection prevention control measures in health facilities, we can contain this virus.
The coronavirus, also known as COVID-19, has been declared by the World Health Organization as a global pandemic. While clinical trials are ongoing for a vaccine and a possible cure, there is no known treatment for the coronavirus. Nigeria has recorded some of these cases, and people are advised to take these preventive measures to keep themselves safe and contain the further spread of the virus. Wash your hands frequently with soap and water, or use hand sanitizers all the time. Maintain social distancing. Avoid touching your eyes, nose, and mouth. Practice respiratory hygiene. If you have fever, cough, and difficulty breathing, seek medical care early. Do not panic. Stop the spread of unconfirmed news. Follow the official government news outlets and report all cases immediately. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network. The main way coronavirus spread is when infected people sneeze and cough. Small droplets of fluid expelled by cough or sneezes are laced with viruses looking for new respiratory tracts to infect. When a sick person sneezes around someone who is healthy, the virus can land in the nose, mouth, or even the eyes, causing an infection. Symptoms can include fever, cough, shortness of breath. Symptoms may appear within 2 to 14 days. Seek medical advice if you develop symptoms and have been in close contact with a person known to have COVID-19, or if you live or have recently been in an area with ongoing spread of COVID-19. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
Great to know you're still with us. And following the closure of schools to check the spread of coronavirus, various organizations and groups have been seeking ways of engaging students meaningfully during this period. One of such ways is by conducting lessons through electronic media such as radio and television. And Chika Ugu reports on the Enugu experience.
The COVID-19 virus pandemic has necessitated the institution of various measures to limit its spread in the country, one of which is the closure of educational institutions. Children might have to stay at home for weeks or months, which could lead to a major disruption in learning and affect learning outcome of some students. However, Radio School, an initiative by the South Saharan Social Development Organization, is designed to improve learning outcomes by providing high-quality curriculum-based lessons for primary school students, junior secondary school, and senior secondary schools through the radio.
Radio School was initially designed to improve adolescent learning outcome for junior secondary school for students in JSS2, in basic science, civic education, including basic gender studies, English language and mathematics. We strongly believe that this model could be implemented across the entire country and serve as a solution to the current education emergency.
The Radio School program was earlier tested in Enugu and Adamawa State with success stories where students inculcated the act of listening, reading and understanding. Teachers also learned different modes of teaching for proper understanding.
South Saharan is willing to provide technical assistance to any states that would want to implement the Radio School model during this emergency and any time thereafter. We are open to partners who wish to support the scale-up of the Radio School to cover other classes and subjects.
The program also covers classes scheduled for the Primary 6 Common Entrance Examination, Junior and Senior Secondary School Certificate Examinations, and Joint Admissions and Matriculation Board JAMB Examination. In Enugu, Chika Ugu, NTA News.
To another cheering one now. At about 1,000 indigent and vulnerable people in Ayamelum local government area of Anambra State have received the conditional cash transfer from the federal government. Nwabufo Nwoye reports that the beneficiaries were full of appreciation to President Muhammadu Buhari for his benevolence in meeting their financial needs in the face of the COVID-19 lockdown.
The federal government conditional cash transfer program beneficiaries in Ayamelum are predominantly farmers, as the council area is known with rice and fish production. Beneficiaries are from Anako, Omo, Umumbo, Ibaku, Ifitogware, and Omasi communities. The household uplifting program, otherwise known as the conditional cash transfer, aimed at responding to deficiencies in capacity and lack of investment in human capital of poor and vulnerable, which took place in Ayamelum, has touched the lives of farmers positively. Some beneficiaries say the conditional cash transfer came at the right time to mitigate the economic impact of coronavirus lockdown and at a time of the beginning of farming season. The beneficiaries promised judicious use of the money received.
I'm very, very happy because the money is really helping me. At least since last year, my condition has changed.
I use the money for train my children. For buy market, I sell.
For the little we are having, we appreciate. And we are begging them to put more, to add more.
Some leaders from the communities also commended the government initiative to contain the COVID-19 pandemic.
The beneficiaries are very happy. They are using it to train their children. They are putting it into business.
I commend our President Buhari to helping my people and the others for the cash transfer.
The desk officer conditional cash transfer program, Mr. Mike Okechi, said The program is hitch-free in Anambra State.
Last week, they were paid 10,000 naira stipend. They were very happy.
The conditional cash transfer by the Ministry of Humanitarian Affairs, Disaster Management and Social Development was carried out simultaneously in Katsina, Nasarawa and Anambra State. In Ayamelun local government area of Anambra State, Nwabufonwoye, NTA News.
And Nigerian Air Force has concluded training of integrated air and ground forces for enhanced performance in dealing with security challenges through inter-service cooperation. And Suleiman Abdullahi Rugachikun has the details.
It begins with preventive measures against coronavirus, an indication that even at this challenging moment of global pandemic, the Nigerian Air Force is not leaving anything to chance on national defense and security. From on-air firing by EC helicopters to ground patrol and onslaught, the graduates demonstrate tactical prowess and procedures for providing insertion and reinforcement capabilities, as well as close air support to ground troops during battle.
The Regiment Training Center will continue to conduct trainings to produce highly professional and disciplined force that will be effective, efficient, and timely in response to our national security challenges.
The integrated training of 18 Air Force personnel and 12 Army in area of offensive and defensive operations enabled by intelligence superiority. Chief of the Air Staff, Air Marshal Sadiq Baba Abubakar, in a message says, is to enhance synergy in mopping up remnants of bandits terrorizing Nigeria.
They are better positioned now to take the fight much more effectively to the bandits, and so I can say the bandits should expect a much more intensified fight.
The training is in addition to the over 4,000 forces earlier trained overseas and locally in order to build the capacity of the Nigerian Air Force. In Kaduna, I am Suleiman Abdullahi Rigachikun, NTA News.
As preparations gear up with Holy Week ahead of the Easter celebration, the Imo State government is cautioning on the need to adhere strictly to measures in place against the spread of COVID-19. Chairman, Imo State COVID-19 Prevention Committee, Professor Maurice Iwu, made the position of government known at a meeting with the Christian Association of Nigeria, Imo State Chapter, and Bright Ibuchu has details.
The Holy Week ushers in the crucifixion and resurrection of Jesus Christ, an important event in Christendom marked as Easter. In view of the celebration, which is only a few days away, the chairman Imo State COVID-19 Prevention Committee, Professor Maurice Iwu, informed the Christian Association of Nigeria in the state of the need to stick to the measures put in place by the government in the fight against COVID-19. He says the annual observance will take a different dimension this year owing to the prevailing situation, stressing that the government is committed to ensuring that the state is protected from coronavirus infection.
One way is to be able to make the churches open and live stream the church proceedings. The other way is to have a limited number of people coming to church who are properly protected and maintain social distancing. There are so many options given, and those options are what I promised them that today, I'm not saying tomorrow, today, His Excellency will hear this concern.
Chairman, Christian Association of Nigeria, Imo State Chapter, Ihaichi Obeji, commended the efforts so far made by the state government. He, however, appealed for consideration towards relaxing the total lockdown in the state to enable Christians hold Easter service, pledging that social distancing will be observed.
The church is organized. So if you want to work for the church or with the church, you have to work with the church leader. The church leader can control it.
In Owerri, Bright Ebuchu, NTA News.
As we take our concluding segment, a peep into the world of sports, and when we return, we wind it up nicely together.
Nigerians, coronavirus is dangerous. It can kill. When you see this sign, high fever, cough, shortness of breath, drowsiness, pneumonia, don't panic, don't hide, don't embark in self-medication. Promptly visit the nearest medical facility. Report all cases to the nearest hospital. Prevention is key. Avoid contact with infected persons. Avoid crowded areas as much as possible. Wash your hands regularly. Use hand sanitizers. Your life is precious. Stay alive. Live long, live right. This message is sponsored by the Federal Ministry of Information and Culture and the Nigerian Film Corporation. Nigerian Film Corporation, powering possibility.
Coronavirus is real. Steps to avoid this pandemic. Wash your hands regularly or sanitize your hands. Keep social and physical distancing. Avoid crowded places. Stay at home unless absolutely necessary. Don't touch your eyes, nose, or mouth if your hands are not clean. Avoid the spread of coronavirus. Coronavirus is real.
Welcome back. And up next is a sports update with Kene Ima Abudike.
The Nigeria Olympic Committee (NOC) has applauded the Minister of Youth and Sports Development, Sanda Dare, on his outstanding achievements within the first 6 months of his tenure in office. NOC President Habu Gumel, in a statement, commended the minister's visionary leadership, which has helped in repositioning Nigerian sport, particularly with the Adopt an Athlete campaign, as well as his contribution towards the completion of the new headquarters building of the Association of National Olympic Committees of Africa, ANOCA, in Jahi, Abuja. Gumel calls on stakeholders to rally round the minister as Nigeria continues her rise on global sports. In athletics, qualifications period for the Tokyo 2020 Olympic Games are suspended until December 2020. The suspension is effective from April 6 to November 30, 2020 Games qualification, following consultation with Athletes Commission, area presidents and council. During the period of suspension, results achieved at any competition will not be considered for Tokyo 2020 entry standards or world rankings. However, athletes who have already met the entry standards since the start of the qualification period in 2019 remain qualified and will be eligible for selection by their respective member federations and national Olympic committees, together with the other athletes who will qualify within the extended qualification period. In football, organizers of the 2022 World Cup in Qatar are strongly denying allegations from the U.S. Department of Justice that bribes were paid to secure votes for the hosting rights to the tournament. Although FIFA had reacted to previous media allegations about the Qatar bid process by insisting that the tournament will not be affected, the fresh U.S. allegations will lead to further questions over the hosting of the tournament, which is scheduled for November and December. With sports update, Kenan Ima Abodike, NTA News.